Question 1. The home health nurse visits an elderly client who has suddenly developed delirium. What should the nurse assess for first? C. Drug intoxication. Drug intoxication from prescription or OTC medications is more common in the elderly because of slower metabolism and absorption. Combinations of digoxin, diuretics, analgesics, and anticholinergics should be examined. The other options can lead to delirium, but onset is gradual. Question 2. A hospice nurse is caring for a client who is actively dying. The client has been receiving high doses of opioids for pain management. When the client becomes unresponsive to verbal stimuli, what is the nurse's best action? B. Continue the opioids at the current dose. The nurse should continue the pain medications at the current dose, monitoring for signs that the client's pain is not well managed. Grimacing or moaning will indicate a need to increase the dosage. Clients who have been experiencing pain will continue to do so, even if they aren't able to verbalize. One of the goals of hospice care is to keep the client as pain-free as possible. Question 3. The nursing instructor is teaching students about ego defense mechanisms. Which of the following statements about ego defense mechanisms is true? C. Ego defense mechanisms can reduce stress and anxiety. Ego defense mechanisms, or factors, defined by Freud as unconscious resources used by the ego to reduce conflict between the ID and superego, are a reflection of how an individual deals with conflict and stress. They are psychological strategies that are unconsciously used to protect a person from anxiety arising from unacceptable thoughts or feelings. Ego defense mechanisms are natural and normal. And NBSB. Common ego defense mechanisms include compartmentalization, denial, displacement, intellectualization, projection, rationalization, reaction formation, regression, repression, and sublimation. They can be adaptive, helping to lower anxiety or attain goals. They can also be maladaptive, developing into neuroses, lack of accountability, or unhealthy coping. People can use a variety of ego defense mechanisms. Question 4. An unconscious client is brought to the emergency department by their friends. The friends tell the nurse they think the client may have overdosed, but they aren't sure what the client took. Which of the following nursing assessment actions will indicate that the cause of the overdose is an opioid drug? A. Checking pupil size. Pinpoint pupils are pupils that do not respond to changes in lighting. This is a sign of an opioid overdose, which is a medical emergency. Taking the blood pressure is important, but it will not indicate the source of the overdose. A mouth odor that is sweet and fruity indicates diabetic ketoacidosis. Eliciting a pain response can indicate level of consciousness, not the cause. Question 5. Following inpatient treatment for alcohol dependence, a client tells the nurse that he will be participating in Alcoholics Anonymous, AA. The nurse knows that AA's primary purpose is to A. Help members maintain sobriety. The primary purpose of Alcoholics Anonymous is to help members maintain sobriety. The other answer options are components of AA that support members. Question 6. When helping a person through grief work, the nurse knows that C. The grief stages may occur in order, they may be skipped, or they may recur. Grief is manifested in a variety of ways that are unique to an individual and based on personal experiences, cultural expectations, and spiritual beliefs. The sequencing of stages or behaviors of grief may occur in order, they may be skipped, or they may recur. The amount of time to resolve grief also varies among individuals. Question 7. A man whose wife and twin sons were killed by a drunk driver 12 months ago tells the nurse at the mental health clinic that he is feeling better. However, which of his statements indicates that he should continue therapy? C. I hate going to bed, because the nightmares just wake me up. Inadequate sleep with nightmares indicates poor grief resolution. The client should continue with counseling. Memories must be resolved to move forward with grief work. After a loss, the survivor should reach a point of moving forward, even if the person still feels sad. Question 8. A 41-year-old client with newly diagnosed breast cancer tells the nurse that she is afraid of chemotherapy because of its adverse effects. Which of the following is the nurse's best response? C. Every woman is unique. We'll monitor your case closely. Chemotherapy can be scary even when necessary. Every client, regardless of diagnosis, worries about its side effects. The nurse should listen to the client's concerns, dispel myths, and offer support. Chemotherapy is carefully administered according to the client's responses. Medications for side effects are administered, but this does not address the client's fears. Good health isn't guaranteed to prevent adverse effects. Reminding the client that there are few options doesn't bolster confidence or trust. Question 9. After presenting to the mental health clinic with complaints of ongoing anxiety, a client undergoes assessment and is diagnosed with obsessive-compulsive disorder, OCD. Which of the following patterns of behavior is consistent with the OCD diagnosis? C. Ritualistic. Obsessive-compulsive disorder, OCD, is a pattern of unwanted thoughts and fears, obsessions, that lead to repetitive behaviors, compulsions. The obsessions and compulsions can interfere with daily activities, leading to distress, causing the pattern to repeat itself with ritualistic behavior. Obsessions and compulsions can also occur independently. Common obsessions are fear of germs and the need to arrange things in a precise way. Common compulsions are constant hand-washing, counting, or checking on things. Perfectionism included actions that can be associated with OCD, but also a normal trait. Paranoia is anxious or fearful feelings related to threat, persecution, or conspiracy. Euphoria is a state of intense happiness. Question 10. A client tells the mental health nurse that they have suddenly stopped taking their prescribed fluoxetine because of the side effects, especially the insomnia. What should the nurse do first? A. Assess the client for risk of suicide. The nurse should assess the client for risk of suicide. Fluoxetine, Prozac, is a selective serotonin reuptake inhibitor, SSRI. SSRIs are generally thought to treat depression by blocking the reuptake of serotonin in the brain. Stopping the medication abruptly can cause severe anxiety or depression, putting the client at risk for self-harm. Withdrawal symptoms include irritability, nausea, vomiting, dizziness, headaches, nightmares, and paresthesias. Although fluoxetine is the least likely of the SSRIs to cause withdrawal symptoms, because of its long half-life, the nurse should carefully assess the client for all symptoms, including suicidal ideation. Close observation and assessment are especially important during the first few months of SSRI therapy and whenever antidepressant dosage is changed, either increased or decreased. Question 11. A child with a facial difference is preparing to attend kindergarten. Parents ask the mental health nurse to help their child respond to rude comments or teasing. All of the following statements are appropriate for the child to say except. C. Don't stare at me. You're not very attractive either. Children with facial differences are more likely to be bullied. Also, others may assume the child has developmental issues. Preparing a child for school can help them cope with comments or teasing in a way that is confident and friendly. They can look directly at the teaser and speak clearly. The child should not fight back or provoke an argument. Question 12. A client with chronic migraine headaches tells the nurse that they are considering acupuncture therapy. The nurse responds, "Acupuncture is weird. No normal person would let someone poke needles into them like that." What behavior or belief is the nurse displaying? C. Ethnocentrism. Ethnocentrism is the belief that one's own culture is natural and correct. Prejudice is an adverse judgment or opinion formed beforehand or without knowledge of the facts. Discrimination is the unfair or prejudicial treatment of people and groups based on characteristics such as race, gender, age, or sexual orientation. Insensitivity is the absence of feeling or tact. Acupuncture, a branch of traditional Chinese medicine, TCM, is 3,500 years older than Western medicine. According to the NIH, it works well on chronic pain, back, neck, osteoarthritis, and headaches. It can reduce the incidence and severity of tension headaches, as well as prevent migraines. Question 13. After a patient has had emergent CABG surgery, his wife tells the nurse that she is anxious about how to help her husband when he is discharged to home. Which resource can provide support for the patient and his wife? C. American Heart Association. A major medical event can cause clients and their families to become anxious. Offering resources can help them cope with self-care after discharge. This patient has had coronary artery bypass graft, CABG, surgery. The American Heart Association has a program called Mended Hearts Club, with local branches. Care providers can also offer support by phone, email, and education. Question 14. A client diagnosed with major depressive disorder tells the nurse, "I can't go on like this. My life is worthless." What is the nurse's most appropriate response? A. Are you thinking of killing yourself? If a client expresses that life is not worth living, the nurse should approach the topic directly by asking, "Are you thinking of killing yourself?" This demonstrates concern for the client and respect for the serious situation. The nurse should also ask if the client has a plan for ending his life. Question 15. A client has recently been told he has terminal cancer. As the nurse enters the room, he yells, "My legs are cold, and I'm tired of having my sleep interrupted by noisy nurses." The nurse may interpret the client's behavior as C. An expression of the anger stage of dying. In the anger stage of Kubler-Ross's stages of dying, the individual resists the loss and may strike out at everyone and everything, in this case, the nurse. A dying person will lose everything and everybody that is important to them, and the person is entitled to feel angry. Question 16. The nurse in a mental health unit asks a client, "Are you ready for lunch?" The client responds, "Am I ready for lunch?" and continues to repeat the phrase all afternoon. This behavior is called C. Echolalia. Echolalia is a non-focused and uncontrollable repetition of words that has no relevance to what is occurring. Clients may not be able to communicate effectively because they struggle to express their own thoughts. Echopraxia is the automatic repetition of movements made by another person. Catatonia is a psychomotor disorder that affects a person's ability to move in a normal way. Cyclothymia is a mood disorder similar to bipolar disorder. Question 17. A client with stage 4 lung cancer is experiencing sadness, mourning, and grief about their terminal illness. Which of the following activities should the nurse encourage to most therapeutically assist the client? B. Attend a support group with other cancer clients. The client should be encouraged to attend a support group with others who are also diagnosed with cancer. Group members can share feelings and experiences that may seem too strange or too difficult to share with family and friends. Giving away possessions can actually increase depression or thoughts of suicide. Joining a campaign or planning a vacation are long-term activities that can also contribute to feelings of sadness or hopelessness. Question 18. When a new client is admitted to the mental health unit, who should provide the client's history? B. The client. Unless a client is in a mental health crisis, such as psychosis, the nurse should collect information from the client. If more data is needed, secondary sources, such as family, friends, healthcare providers, attorneys, or police can be employed, too. Question 19. When a female presents to the emergency department, stating she has been raped, what is the nurse's first priority? A. Get permission to obtain safe shelter. After providing medical treatment and collecting evidence, the essential action is to ensure the client's safety. The nurse's first priority is to contact someone who can provide shelter and support for the client. The client may also need counseling and assistance with legal proceedings, but not at this time. Question 20. The daughter of a 74-year-old female client with early-stage Alzheimer's disease, AD, Tells the nurse, "I'm so tired of hearing Mom talk about the past. It's the same old stories." What is the nurse's best response? B. She has lost her short-term memory, but she can still remember events from long ago. When a client with Alzheimer's disease, AD, loses short-term memory, family members can become frustrated. AD begins in the hippocampus, deep within and part of the temporal lobe of the brain. The hippocampus is the structure responsible for creating new memories from experiences. When it is damaged, short-term memory is not possible. Question 21. A terminally ill patient tells the nurse, "I'm afraid I won't be allowed into heaven." What is the nurse's most appropriate response? B. Can you tell me why you feel that way? When a patient expresses fear or concern, assess the situation before assisting with a solution. This client may have other fears beyond impending death. Ask a few questions to determine the best resource. A chaplain may be helpful, but don't assume the patient's fear is spiritual. Past coping methods may also be useful. Telling a client not to worry is inappropriate. Question 22. Which condition has the highest mortality rate of any mental disorder? B. Anorexia nervosa. According to the National Institutes for Health, anorexia nervosa has a fatality rate of about 10 to 20%, the highest of any mental disorder. Clients with anorexia nervosa have a high risk for suicide, as well as the physical impact of chronic malnutrition. Sudden heart attack and multiple organ failure are two complications. Treatment is difficult and relapse is common. Treatment outcomes: 50 to 70% will recover, 20% will improve but still struggle, and 10 to 20% will die. The other mental disorders have some mortality risk, but not at the same rate as anorexia nervosa. Question 23. The nurse is caring for a client who is unable to speak after a stroke. How will the nurse interpret the client's facial grimace? A. Pain. A grimace is a nonverbal behavior that expresses pain. Depending on the situation, it can also indicate disgust or disapproval. Question 24. When the nurse enters a client's hospital room to administer a medication, the client states, "I don't want to take that pill anymore." What is the nurse's best response? A. Can you tell me why you decided that you don't want to take this? While a client has a right to refuse treatment, including medication, the nurse should get information about the client's decision directly from the client whenever possible. For this client, there may be a misunderstanding about the purpose of the medication, or the client may be experiencing unpleasant side effects. The other answer options are not therapeutic or appropriate responses. Question 25. When administering haloperidol, Haldol, to a client with a psychotic disorder, the nurse knows to observe for which adverse effect? A. Drooling. The nurse should assess for Parkinsonian signs, including drooling, a mask-like face, a shuffling gait, difficulty swallowing or speaking, inability to remain still, and stiff limbs. Other adverse effects of antipsychotic medications include extreme drowsiness and lethargy. The other answer options are occasional adverse reactions. Question 26. The nurse in a memory care unit is assessing a new medication prescribed for a client with advanced Alzheimer's disease. If the medication is effective, what can the nurse expect to observe? A. Less physical and verbal aggression. If an antipsychotic medication for Alzheimer's disease is effective, the client will display less physical and verbal aggression. When aggression is diminished, there may be less resistance to ADL and the daily schedule, along with excellent nursing care. Currently, there are no medications to improve short-term memory. Question 27. A Jehovah's Witness client is transported to the emergency department with multiple traumas requiring immediate surgery. The nurse knows that. B. Blood transfusions are not permitted. Jehovah's Witnesses do not accept blood or blood products. According to the Watchtower Bible and Tract Society, a transfusion may result in the immediate and very temporary prolongation of life, but at the cost of eternal life for a dedicated Christian. The religion follows scriptures in the Bible that require abstention from blood. It also holds that God equates blood with life, and Jehovah's Witnesses must be obedient in all ways, including not accepting blood. Question 28. After visiting his father in the Alzheimer's unit, the adult son finds the nurse and says, "I'm so excited. Dad's been telling me stories about growing up. I think his memory is returning." What is the nurse's best response? C. He still has long-term memory, so that's what he talks about. The progression of Alzheimer's disease can confuse family members. The client's ability to relate a long-term memory may make it seem as if the client is improving. The nurse should remind family members of the true situation and not provide false hope. Question 29. The nurse provides teaching for a client who will receive electroconvulsive therapy, ECT. Which statement by the client indicates a need for further education? A. I will be able to recall the treatment when I wake. Electroconvulsive therapy, ECT, is a medical treatment most commonly used in clients with severe major depression or bipolar disorder who have not responded to other treatments. ECT involves a brief electrical stimulation of the brain while the patient is under anesthesia. Nursing education includes the following. 1. Treatment typically requires 6 to 12 sessions. 2. The client will receive a muscle relaxant and short-term anesthetic prior to ECT. 3. During ECT, an electric current causes a seizure in the brain. 4. Several minutes after the treatment, the client will wake up. They will not remember the treatment. Question 30. A client's family member asks the nurse, "The doctor said he will provide palliative care. What does that mean?" Which is the nurse's best response? B. Palliative care aims to relieve or reduce symptoms of the disease. Palliative care is specialized medical care, with the goal of prevention, relief, reduction, or soothing of symptoms of the client's disease or disorder. There is no specific timeframe, nor is there an effort to cure the client. Often, care takes place in the client's home, with support for the entire family. Question 31. During an intake interview, a client with a history of alcohol abuse tells the nurse, "The only reason I drink so much is because my wife is such a nag." The nurse knows he is using which defense mechanism? A. Rationalization. Rationalization, also called making excuses, is a defense mechanism that creates excuses for inappropriate behavior and actions. The client offers justifications or tries to blame someone else for what they know was wrong. Question 32. The nurse attends a workshop to learn how to use people-first language when speaking about clients and their medical conditions. All of the following examples are appropriate when using people-first language except B. He is afflicted with cerebral palsy. It is incorrect and demeaning to describe someone as afflicted by or suffering from. People-first language, PFL, puts the person before the disability, and describes what a person has, not who a person is. PFL uses phrases such as person with a disability, individuals with disabilities, and children with disabilities, as opposed to phrases that identify people based solely on their disability, such as the disabled. Putting the person first shows respect and compassion, and separates the person from their medical history. Outdated terms include crippled, handicapped, wheelchair-bound, and mentally ill. Question 33. During a routine checkup, an elderly man tells the nurse how proud he is of his gun collection. The nurse then asks him the ages of his grandchildren, because school-age injury or death from guns is correlated with C. Access to firearms. Unsecured firearms that are accessible to children are a public health issue. The CDC estimates that a child dies by accidental use of firearms once every other day. The nurse should assess the situation and report it to the appropriate authorities. Question 34. The mother of an adolescent boy with celiac disease phones the clinic to report that her son is experiencing severe diarrhea and cramping after having eaten pizza the evening before. "He told me he doesn't want to be different from his friends," she tells the nurse. The nurse knows the main issue is B. Low self-esteem. Adolescents feel secure when they can be like their friends. They tend to adopt the same behaviors and attitude. The management of celiac disease requires constant attention to a gluten-free diet, so the teen feels different when he is unable to eat the same foods as his peers. He may develop low self-esteem or depression because of social difficulties or stigma. Question 35. Which of the following statements best explains the role of the nurse when the nurse is planning care for a culturally diverse population? B. Provide care while remaining aware of one's own biases, focusing on the client's individual needs rather than the staff's usual practices. the nurse must remain aware of their own beliefs and values. Otherwise, the nurse's biases or preconceived notions might create an unexpected conflict or an area of neglect in the plan of care for a client, who might be expecting something totally different from the care. During assessment, the nurse should identify the client's values, beliefs, and practices and use them as a guide when making choices to meet the client's needs and outcomes. Identification of values, beliefs, and practices allows for planning meaningful and beneficial care specific to the client. Question 36. An 82-year-old patient diagnosed with delirium approaches the nurse, worried that she is late for her dental appointment. "I never miss a checkup," she says. Which of the following is the nurse's most appropriate response? D. You're in the hospital right now. My name is Space. I'm one of the nurses. Clients diagnosed with delirium are easily confused about time and place. The nurse should calmly orient the client with date, time, and place, and introduce himself or herself. The other options do not address the disorientation. In fact, pretending that the client has an appointment only reinforces the confusion. Question 37. During an admission for alcohol dependency, the nurse obtains the history from a client with multiple convictions for DUI, driving under the influence. The client admits to having had a few drinks a day with my friends. What is the nurse's most appropriate response? D. Can you explain how a few drinks led to multiple arrests? The nurse should not minimize the serious effects of alcohol abuse. Clients must acknowledge the consequences of their behavior to start their recovery. Question 38. Bereavement may be defined as D. The period of mourning after a death. Bereavement is the period of grief and mourning following a loss or a death. Grief is normal, experienced as a combination of mental, physical, emotional, and social reactions. There is no timeline for how long bereavement lasts. Factors involved include the cause of the death, closeness to the deceased person, and the presence of support. The goal of the bereavement period is to learn to move forward without the person who died. Question 39. A 63-year-old male of Chinese descent complains of severe postoperative pain that does not respond to analgesics. He tells the nurse, "If I could get acupuncture, my pain would go away." The nurse understands that Asian cultures use acupuncture too. D. Restore energy balance. Acupuncture is a form of alternative medicine and an important part of traditional Chinese medicine. Its purpose is to restore the balance of energy in the body. The belief is that when energy becomes blocked, the result is pain, dysfunction, or illness. Acupuncture restores the healing process. Studies have shown that acupuncture does have benefits. Question 40. The nurse is talking to a client with a diagnosis of alcohol use disorder. The client is a musician and tells the nurse, "My drinking doesn't hurt anyone. Besides, it helps me to relax and be more creative." Which defense mechanism is the client using? D. Rationalization. Denial is the belief that there is not a problem. Rationalization justifies behavior as being adaptive and reasonable. Both the teller and the listener find the rationalizations more satisfactory than the reality. Intellectualization is when a person avoids uncomfortable emotions by focusing on facts and logic. Projection is the assignment of one's own feelings or thoughts to others. Question 41. A 57-year-old female with amyotrophic lateral sclerosis, ALS, tells the nurse, "I can't even comb my own hair anymore." The nurse notes that the client appears untidy and distressed. How should the nurse respond? D. Tell me more about how you're feeling. Always begin by assessing the client. There may be other reasons for her distress, so the nurse should not make assumptions. The other options all contain a level of judgment and take the focus away from the client and her feelings. Question 42. A 23-year-old female has been admitted to the inpatient mental health unit with a diagnosis of major depressive disorder. She tells the nurse, "My mother stopped loving me when I was a baby." What is the nurse's most therapeutic response? D. Can you tell me why you believe she stopped loving you? The nurse should ask a non-judgmental, inquiring question to get more information about the client's belief. The client must feel supported in order to continue to explore her perceptions. The other options minimize or discredit the client's statement. Question 43. A 17-year-old girl has been transported to the emergency department by EMS after she was in a motor vehicle accident. She starts to sob inconsolably, telling the nurse, "I just got my license, and I wrecked the car. My parents are going to kill me." Which should be the nurse's first action? D. Sit at eye level and tell her, "It's scary. Just take some deep breaths." When a client is in a crisis situation, start by helping the client to decrease anxiety. Give simple directions that are helpful. Focus on the client. Use therapeutic touch if appropriate. The other answer options do not address the client's anxiety, and they may not be true statements. Question 44. A public health nurse is preparing a workshop on stress management. Which of the following learning points should be included? D. It is possible to control the response to stress. Stress is a normal part of life, so avoiding it is impossible. However, the response to stress can be managed. Others may be able to help, but the idea of stress management is to learn which techniques are personally effective. Question 45. According to Bowen's family systems theory, what is differentiation of self? D. Individual feelings and thoughts in the family. According to Bowen, a family is a system in which each member has a role to play and rules to respect. Bowen's theory has two aspects: togetherness and individuality. A healthy family has a balance of the two. Differentiation of self is the first concept, in which family members gain the ability to separate their own feelings and thoughts from those of other members.